Kiều Thu xin kính chào quý vị. Thưa quý vị, trong chương trình hôm nay, chúng tôi xin mời quý vị đến tham dự buổi tiệc gây quỹ tại nhà hàng Lucky Tree ở Falls, Virginia vào cuối tuần qua, được tổ chức bởi WHA Success. Trong những chương trình trước, chúng tôi đã giới thiệu đến quý vị những sinh hoạt của WHA Success cùng những khuôn mặt nổi bật của những người trẻ tham gia vào dòng chính và trở lại giúp cho cộng đồng, trở lại giúp cho những người bạn trẻ của mình tiến thân trong xã hội, vấn đề học đường. Và thưa quý vị, trong buổi tổ chức vừa rồi, WHA Success được sự yểm trợ của rất nhiều hội đoàn khác để tổ chức một buổi gây quỹ với chủ đề là Blue Hawaii, và những kết quả thâu lượm được trong những cái chương trình gây quỹ này sẽ được dành để tổ chức những cái chuyến công tác về y tế để giúp đỡ cho những người thiếu những cái phương tiện và kém may mắn ở các nước chậm tiến hoặc là các nước ở Đông Nam Á như là Lào, Campuchia và Việt Nam. Thưa quý vị, WHA Success phải nói là gồm những khuôn mặt trẻ, những khuôn mặt mà đáng cho chúng ta hãnh diện, và họ đã cố gắng làm một nhịp cầu để đem cho các thế hệ người Việt hải ngoại lại gần nhau hơn. Gia đình, bố mẹ, phụ huynh cùng những lớp trẻ lớn lên hoặc là sinh trưởng tại Hoa Kỳ.
Good evening. Today is October 5th, 2007. We are at the restaurant of Lucky Tree to attend the fundraising of WHA. This is an association that went back to Vietnam and also the Asian countries to have the people who need medical care. Please following the program today.
What do I think about my work in Vietnam? Well, I actually have another project in Vietnam where I work with the CDC in the area of HIV/AIDS, and my job is actually a trainer for Vietnamese healthcare workers. So I train the physicians there on how to take care of HIV and how to treat HIV patients. In addition, I'm also involved with WHA, as you know, and our last project was a trip to Cần Thơ, which is a city in the Mekong Delta in Vietnam, and we continue to be working in Vietnam on different projects. We have a project right now to support 3 children to do. We're going to support them for surgeries for their congenital heart defects.
Well, originally when I was going, I had no idea what I was doing because obviously I'm not in the health profession. So I figured, what is there for me to do? But as things progressed, I started helping Anting, the director. I helped coordinate a lot of things, and with the finance, I do have an accounting background, so I kind of help with the finance while we're in Vietnam. Obviously, we had a lot of money that we were spending, both on lodging, food, and helping the people in Vietnam. So I helped with the finance, and then when I got back there, my Vietnamese is not that well, but we had a couple of doctors that did not speak Vietnamese, so I helped translate it. It was difficult at first because there were a lot of terminology, health terminology that I didn't know, so I actually had a dictionary with me to be able to translate, but it was definitely a touching moment. I've never done anything like this before, and obviously I was born in Vietnam, but left when I was 2, didn't know much, but it was very self-rewarding, and it's very touching to see people's lives being touched by you just by being there. So it was a great experience. Thank you.
Cảm ơn Mai Khanh. Phương là volunteer for WHA since 2004 and I participated in the 2005 medical mission to Cambodia. And cái lúc Phương đi tới nước đó, Phương rất là cảm động. It was shocking because the country is very poor. The kids especially need a lot of medical and dental care. And the average salary for a family is $5 a day. And the way they live, the way of life is devastating. They basically have just a roof, just like 4 poles and then a straw roof as a house, no walls. And then we visited another village on the water, and people were living on small boats. And they use the water for everything. They use the water for bathing, for cooking, doing personal hygiene there. So that's why a lot of kids and adults alike have parasites, parasitic infections, and among others. Làm cho Phương rất là cảm động. So even though Phương đi đó khoảng chừng 2 tuần, Phương muốn ở lâu nữa để giúp, but it's it's something that's hard to do as ông sếp chỉ cho nghỉ có 2 tuần maximum thôi. Nhưng mà Phương giúp by doing other stuff behind the scene. You really don't have to go on the mission to be helpful. Like you can volunteer behind the scenes with fundraiser like tonight, Blue Hawaii. So we hope to raise money for a 2008 mission to Laos. So hopefully Mai Khanh could join us too.
Well, I'm happy to be here tonight and join with so many young Vietnamese professionals who are out here raising money for the World Health Ambassadors. This will take and help people in Vietnam, in the Philippines, and in Laos. And it's a wonderful program of sending doctors abroad and medicines abroad to help people that otherwise could die for lack of health coverage.